Today we're going to give a shot with the Humalog insulin pen. So the first thing you do is you take off the lid, and we have to make sure the top of the insulin is clean before we put the needle on. Take an alcohol wipe and wipe off the top, and I'm going to save this alcohol wipe to wipe off his arm. You take the needle and open it up without touching anything. You put this straight on, turn it clockwise, and then pull off this cap and the green cap. You take both of them off. You have to prime the needle before you can give an injection. So you have to turn it to 2 units of insulin. So you can see it's lined up at 2. And then you have to make sure that the insulin comes out before you give a shot, because sometimes the needle's faulty and it doesn't work. If that's the case, you have to put on a new needle tip. So we're gonna see if the insulin comes out. Okay, so it did come out of the needle. So now we're gonna turn the dial to the amount of insulin that Evan needs for this meal. So I'm gonna turn it to 1 unit. So these are half unit marks. So that's half a unit and there's 1 whole unit. So this pen, you can only give half unit doses of the insulin. So if you have to do something in between that, you have to either round up or down for that dosing. Okay, so now it's set at the correct dose, and I'm gonna clean off the site. So I take the sterile alcohol swab and I wipe the skin. I wait for it to dry. Never blow on the skin because you can introduce germs from your mouth. So if you want to dry it faster, you can kind of wave it with your hand, but never blow on it. Okay, so I'm gonna pinch up the skin a little bit where I'm gonna give the injection. I'm gonna go straight in, and then I hold in the button for 5 seconds, comes straight out, and then Evan's got his dose. When we're all done, you put on this clear lid again, pinch it at the base and turn it counterclockwise. Then this you discard in a sharps container, and then you put the pen back in the fridge.